I'm Dr. Gelfound, and we're going to go over some modality today. Today we're going to use what's called the laser, and this is a low-level laser that we use here in the clinic for either some wound healing or enhanced healing effects for injury or pain management. And it's becoming a widely used modality. Lasers in the early 60s and 70s were being used frequently, but then the FDA felt there was not enough evidence to support the use of them for medical purposes and treatment purposes, so they kind of banned them for a little while until enough research was performed, and then they started to come back into use probably in the mid-90s, and we see them almost all over now in a lot of different inpatient, outpatient type settings, and we use them here in the clinic for a variety of different conditions. And I'm just going to go through some of the physics maybe behind laser. So laser, if you didn't know this, actually is an acronym for light amplification by stimulated emission of radiation. So we're just emitting light in a way so that it radiates through the tissues so that we can get an effect. And the effect we're looking for is healing or pain management. And what happens in our bodies is that we have certain chromophores, which are light-sensitive substances inside the mitochondria, which is an organelle inside every cell in your body. So every cell has these, and your body is made up of trillions of cells, but these are very light sensitive. And you see these in the eye, in the retina, and you see these out in the environment in plants. We all have studied photosynthesis when we were in school, and that is how a plant takes light and turns it into energy, and then the plant grows. We have the same properties in our bodies, and that's what these chromophores do. So chromophores are stimulated between a wavelength of 600 to 1200, and this right here is nm, that stands for nanometers, and that's the measurement scale for wavelengths. And we have two different wavelengths that we're using here with this particular unit. Visible light that we can see is a slightly longer wavelength, and that's the higher end, closer to 1200. And then the shorter wavelengths are the ones we can't really see, which would be the near infrared or infrared. And this particular apparatus here is what we call a wand or a diode. So this is the method that we use here. There are other different methods that may be utilized in different clinics. But this allows us to operate around the body really quickly, and we can stimulate the tissues in a very quick way, and then the treatment is done. Now this also is a diode that has multi diodes inside. So the diodes have different wavelengths, and so we have a variety between 640 and I believe 900 in this diode right here. So just to give you an example of what that might look like. Now these low-level lasers don't require goggles or anything like that. And when I shine it on the board, you should be able to see some of the redness that shows up. Now, even though we don't need goggles, we certainly don't look directly into these diodes because, again, our eyes, our retina are sensitive to these types of wavelengths. So you can see the redness because that's the diode that you can see. What you can't see is a wavelength that is the near infrared, which is the shorter wavelength, and that also is stimulating tissue. Now the key with this is when we're going to stimulate the chromophores, we have photobiostimulation, and that is what we use for wound healing. So that's the lower end power sources or the lower end kind of intensities. We also have photobioinhibition, which is the higher end, more intense, and that's more for pain management. Let me just show you how this might work. In this particular manual, we have a condition of medial epicondylitis. That stands for the medial part of the elbow. Golfer's elbow is another term for it, and it has to do with the tendonitis. We use this to, one, we can do pain management, and two, we can heal it. So we'll set it up for just a short burst, and you'll see there's going to be a red glow right around the diode, and that's pretty much how the treatment is used. This particular treatment time is just 30 seconds, and I'll do this 2 different spots around the elbow, and we're done. Now, there are different treatment times for different conditions. Not every condition gets treated exactly the same, and not every condition responds the same. And each individual is different. Some people have better healing rates than others, and a lot of that has to do with the individual itself. People who eat well, have a good balanced diet, they don't eat a lot of meats or animal products. People who take some supplements, vitamins such as a multivitamin with calcium, magnesium, and zinc, vitamin C. If they have an overall healthy environment, they're going to heal faster than others. The most significant thing I'd ever seen with this particular machine was a patient who I was treating their shoulder, and they happened to walk in with a limp, and the patient had been a diabetic. They had a small ulcer on their toe that their medical doctor had been trying to treat for months, and it wasn't healing. So at the time I was treating him with the shoulder, I decided, let's expose you to our laser for the wound healing effect. And literally within 2 weeks, his ulcer had healed and he was able to return to work. That had been the most dramatic thing I'd seen with the laser. Other than that, we typically use it for pain management with tendinitises and other conditions. Again, if you've got questions related to conditions and you need to send me a question, just do it right over the YouTube. I'll get back to you right away. So that's low-level lasers, light amplification by stimulated emission of radiation. It's a great technique. You ask your doctors or your therapists for these things, and it'll enhance your healing.